showed that patients are more likely to send female doctors more demeaning messages, negative messages through the portal than male doctors. But there is something about being a female physician that is shortening our lifespan, right? Patients that are treated by female doctors have better outcomes. The corporate medicine world does not reward the way female physicians practice.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. If you've ever struggled to explain DPC, listen to the end of this podcast. I'll share a DPC savings calculator for patients that you can use to compare DPC plus a health share versus traditional insurance, and then how it fits in a larger system so that you can open your practice with patients already lined up. Let's get into this week's episode. I want to explain something that I am starting. It's called the Independent Practice Path, or IPP. Becoming the boss. I mean, it's very difficult if you've always been an employed physician. So I've been hearing the uncertainty and the fear of how do I become a practice owner in a reasonable and sustainable way? How do I get patients? How do I explain DPC to them? How do I make sure that I'm going to be able to make the income that I need? So that's what the independent practice path is. It's going through all of those things to help you transition from employed physician to independent practice owner so that when you open your doors, you are not actually just opening. It's a continuation of what you've started several months prior. You're going to learn how to explain DPC to patients, to employers, family members, other doctors, colleagues, and you'll start those conversations early from the very beginning. You're also going to start building your systems so you don't start with a Google worksheet and just your phone and that's it. I want you to have systems that you would find in a mature DPC practice. The goal is to open a practice with momentum. So you're not just opening your doors and waiting for people to come to you. I'm starting this as a small initial cohort because this works best when people can talk to each other and hear how other people are doing things, and they work through some of these situations together. The independent practice path is what I set out to do over a year ago. I wanted to help doctors who are ready to get out of the fee-for-service system be able to succeed in DPC. There are certain things that you can do to try to make sure that you will succeed. So if you are seriously thinking about getting out of employed practice and you want to talk to me about this, just email me through the email in the show notes. Tell me about your situation, where you are in the process of planning a DPC, and then we can figure out whether this would be a good fit for you. Just remember, no matter where you are on your DPC journey, your DPC family's got your back. Today, I am very excited to welcome back Dr. Noemi Adame. And we talked several months ago, but she's had some new things that she's learned and found out about her practice since then regarding her systems and automations. I'm going to take a step backward, and last time we talked a little bit about the pieces that you've written about how women doctors, how their workload is different from male doctors. Can you just kind of recap that for us?
So when it comes specifically to gender bias in medicine, physicians have a very different job than male doctors. And I've spoken out in different podcasts. I've written articles about it that have been featured in SoMe Docs and Kevin MD. Basically, it boils down to this. Patients expect different things from us than they expect from male doctors. Patients demand more from us. They treat us differently. Some objective findings in studies include, for example, that patients send, and this is in the primary care setting using portal data, patients send female doctors 25% more messages through the portal than they do male physicians. And this is accounting for different variables, including complexity and panel size. And another study, a little more recent study, was pretty eye-opening, showed that patients are more likely to send female doctors more demeaning messages, negative messages through the portal than male doctors. The same study that showed that patients send female doctors 25% more messages also showed that staff send female doctors 24%, essentially the same, more messages. So not only are female doctors getting more messages and demands, right? Because every message, it comes with work, right? You have to dig through the chart. You have to make decisions. You have to review, right? You have to, engage your clinical reasoning and decision-making skills, and then send the message or any additional orders that go. So it's not just about, you're not answering, it's not like answering your kid's text saying, hey, what's for dinner tonight, right? Answering a message from a patient is a whole different thing. So we have more demands or more expectations from patients. We have more expectations from staff. There's also some soft skills expectations. Both patients and staff, some studies have shown, expect female physicians to be more nurturing, be more giving, be more available. And so all of that comes with invisible labor that you're not compensated for, certainly not in the corporate world. And it takes its toll. And it explains why female doctors have higher burnout rates. We have higher rates. This is compared to our male physician colleagues. We have higher rates of depression, higher suicidality. This is serious, right?
I think you mentioned longevity data as well.
The longevity data was very interesting. So in the general population, in the general population, women outlive men by quite a few years, almost a decade. That longevity benefit is not seen amongst physicians. We do not have that longevity benefit with our male colleagues that women in the general population do. And what's interesting is, because you might think, well, it's, because it's a stressful job. And so, but when you compare other high earning, high achieving professions like engineering and law, women in those professions do have a longevity benefit over their male colleagues. But there is something about being a female physician that is shortening our lifespan, right? It is shortening our lifespan. And I do think it's because there are expectations from all angles, from staff, from patients, from our families, from our communities. I know certainly as a physician in a rural community, I have been asked by my community to do things that I can guarantee it's probably things that a male doctor would be asked to do. So from a perspective of physician well-being and how it intersects with tech is, I think that, we always talk about boundaries, right? Oh, you need to set boundaries. But having to constantly reinforce boundaries and say no, I can't do that, or no, that's not an appropriate request, or no, you need to do this instead, or having to, or even just read through the request or take that request, process it, and have to make a decision about it. All that also takes its toll. So I'm all about setting systems up to prevent, right? I'm a primary care doc, right? So I'm all about prevention. So I really feel and really encourage DPC docs to set up systems to basically act as a buffer, right? So that you're not fielding and having to constantly reinforce boundaries, having to constantly answer the same questions over and over about whether you take insurance. It is demoralizing to have to answer 20, 30 phone calls about, hey, do you take insurance? And have to say no and explain the DPC model to have one or two people sign up. So if you have a system that either prevents those inquiries because people can go to your website and already know what the process is, or to have some other way to qualify leads. So by the time someone does filter through and you do answer that phone call, they already know some of those basic questions, right? They already know some of those the answers to some of those basic questions. And 5 years ago when I opened, that was, there really weren't a lot of those options. And now there are, right? With AI, I know people have very mixed feelings about AI, but now with more robust CRMs, like your Harmony Ops, now with AI, there are ways that you as the DPC doc, even if you have a micro practice, even if you have no staff, you do not have to be answering those questions and basically suck up your bandwidth and your emotional labor in answering these questions that are just going to exhaust you, because it is exhausting. And instead, it's going to free up your bandwidth for the things that matter, which is direct patient care, that personalized touch to your patients who have already committed to you and who are already enrolled.
Yep. Okay, we're done. Thank you. You just wrapped it up. No, you did bring up all the points.
Yeah.
All the points that I wanted to kind of raise today. And usually the podcast, we just like very freeform, but there's a couple things that I definitely wanted to touch on today. And you've kind of pointed all of those out. So I'm going to back up a little bit. And yes, you're right. DPC doctors, it would be really interesting, wouldn't it, to do some kind of study about DPC doctors? Like, do they live like women DPC doctors?
It's funny because I'm a data person, right? I'm crunchy, but then I'm also very data driven. So and I've evaluated the literature on gender bias in medicine and the different burdens between female doctors and male doctors. And there's a lot of data out there, but not specifically in DPC. First of all, it's a relatively young field. It's a relatively small field. And most of us are not in academics, right? It's so funny because when I was in academics and somebody said, oh, you should do a study on that, I was like, oh yeah, sure. Because I had access to an IRB. I had access to a statistician. I had access to all these very eager medical students and residents who were more than happy to, lend their labor to have their name on a paper, right? When here I am in rural Indiana, right, looking out at my cornfield, and I don't have those resources, right? So, and that's for a lot of us. We don't have the resources to say, yeah, let's do this. And it takes a lot more to be able to pull that data. But yeah, I think it would be very interesting. So yes, all the data that I have on gender biases in medicine is not taken from the DPC world, but I do feel like it applies because all this data is from different fields. For example, the data that shows that female physicians have better outcomes, right? That is in surgery, in primary care, in hospital, in hospital medicine, and in multiple studies, multiple fields, patients that are treated by female doctors have better outcomes. And we're talking, for example, in the hospital medicine world, decreased length of stay, decreased readmission, decreased mortality. In the surgical world, it's also decreased mortality, decreased readmission rate. And it's not because we have better training, right? We go to the same medical schools. It's not because we're necessarily better doctors. It's because we practice a little differently with some of those soft skills. We listen more. We are less likely to interrupt. We're more likely to adhere to clinical practice guidelines, right? This is what the literature shows. This is no shade to my male colleagues, right? Love and respect my male colleagues. But all those things, nobody is handing out bonuses for listening more to patients, right? No one is handing out bonuses for interrupting patients less. So certainly in the corporate world, the corporate medicine world does not reward the way female physicians practice. They don't, it doesn't. So in our world, in the DPC world, where, we've said this before, I am the system. You can, first of all, create your workflows to protect yourself, to protect your energy, to protect your bandwidth, to protect your time. But you can also price in a way, for example, as a female doctor, where you can keep your practice size smaller than perhaps your male counterpart would do. Because if patients are demanding more from you, if your community is demanding more from you, if your family is demanding more from you, if staff is demanding more from you, guess what? You're going to need a smaller panel size than maybe a male doctor that's practicing in the same field and in the same market, in the same demographic. And so that to be able to compensate yourself, that does mean pricing differently, but also setting up automations to protect yourself.
Right. Yes. Because there's only so much of you to go around.
Right.
And I love Dr. Amy Walsh. She's so funny. She's always like, you are not an all you can eat Dr. Buffet.
Yeah.
And no one's going to protect that except for you.
Right. Yeah. Yeah.
So, okay. So I have a few things what I want to do is kind of talk about these few things that, you and I have noticed in practices, and not only talk about how we're doing it now in our own practices with automations, but how can people who are starting out maybe and they don't have a CRM, they don't have, automations yet, like what can they do that will at least help them to protect themselves? So, okay, first one, messages. You've got lots of things that you do, and I know I have things that I do. So we'll hold those. So one thing I was thinking about with messages, so people will, a lot of times, like you said, you get into questions about, like, do you take my insurance? And, those kinds of things. And so if you are getting phone calls or text messages or, things like that, one thing is to have, like, they call them text snippets, or like you can use something called a text expander. So it's if you say
like
the same thing, a macro, the same thing over and over and over again, and then that way that'll save you a little bit of time, and you're just not pouring that kind of energy into that. So that's one thing. And now you use auto replies.
Yes.
Tell us about those.
So what I have noticed now that we have a go high level type of a CRM similar to your Harmony Ops, when somebody either calls or texts us, and this is pre-patient, right? This is not someone who is a patient. If somebody calls or texts our publicly listed clinic number, they get an auto text reply. Okay, so they call and we miss their call, which typically we do. We don't typically answer. Or if they text us, they get an auto reply that says, hey, to start your journey with us or to enroll in our practice, go to our website, and it has the link to our website, and sign up for a group Q&A, which is what we call the meet and greets. We don't do one-on-one meet and greets, we do group. So what I have noticed is that people who do either call or text and they get the auto reply, within a few minutes, they sign up for a meet and greet. So we don't have to reply, right? You don't have, whatever it is that their question was, it's okay. It's going to be answered in the meet and greet. And we might end up replying again, just for that personal touch, but we've already captured their data. Right. Okay. We've already captured their data, and then they already know, oh, I'm going to have my questions answered at the meet and greet. So that's the first one, is having auto replies. I noticed that it kind of stops the back and forth, because they get this auto reply that says, hey, go to our website and sign up for a meet and greet, and you'll have all your questions answered at the meet and greet. They kind of stop. They just sign up and they don't answer any more questions. Or that we might get a message like, hey, thanks, I already signed up for the meet and greet, which is like, okay, great. I don't, we'll answer that. So that's one. I actually took it a step further, because sometimes you do have people that are like, well, my meet and greet, because we do meet and greets only once a week in their group. Some people are like, well, I like to join before then. So what I did is, and this is especially for our complex neuroimmune population, if they signed up for one of like our PANS Pandas meet and greets, which we do separate, they get tagged Pandas, and that group that gets that tag gets an automated email that says, hey, thank you for signing up for our group info session. We're going to have about 3 to 8 people, and sometimes people have a lot of questions. So why don't you watch this video first, where Dr. Adame talks about her path that led her to opening up her practice, her background, her path to how she ended up taking care of or becoming the regional expert in PANS and Pandas, how to enroll in our practice, and what to expect after you enroll. So they basically I recorded like basically the first half of a meet and greet. And so they watch the video. I also have links to several blog posts where I talk about my approach to Pandas, my diagnostic, my holistic non-pharmaceutical approach, my Western pharmaceutical approach, how we do follow-up and ongoing care. So they basically do all of this before they sign up for the meet and greet, but before they actually do the meet and greet. And we give them the option. If after learning all of this, watching this video, reading this blog post, you're ready to join, here's the link to enroll. If you still have questions, Dr. Adame will answer them at your scheduled meet and greet. So we've had a couple people that signed up from that. So, and that reduces I signed up for a meet and greet, but I want to talk to someone, like you've already, and usually the questions that they have are answered in that video and in the blog post. So, and I know that some people will say, well, that seems so impersonal, and that it's not, I don't feel it's about being impersonal. I feel it is about making sure that you are automating the things that are repetitive, and answering those questions that are repetitive. So that frees you up, that if I have a patient who's established, who's already paying me, that texts me, hey, my kid is sick, I have the time for them, right? I have the time for them, for my patients that are already part of my practice, instead of, and my team, same thing, my team is an extension of me. So that way my team is working on referrals, working on prior auths, working on, again, we have a very complex population, do letters to school, whatever it is that we need to do. We are focused on our patients because we are doing pre-education marketing, basically, to the people who sign up for a meet and greet, answering their questions. The other thing is, because we do meet and greets and they've gotten pretty big, anywhere from 4 to 8 people will sign up and everybody has some questions. By doing that that little video, I don't have to talk a lot. I just go straight to questions. That was the other reason why we added the video. So that automation has really helped with people who either want to sign up, they're ready, right? They don't need the meet and greet, or to make the meet and greet more productive. So that's one of our automations that we've done. Yeah.
That saves you so much time.
So much time.
Yeah. And effort.
Oh my goodness. And it is a time investment up front, but then
right. It's so nice after, right?
Once it's done, it is so nice. Yeah.
And the video that you made, what you did essentially is you took all the questions that people have already asked you in the past and just put them all in one, because you know what they're going to ask you.
Right. I recorded the meet and greet. I recorded a meet and greet that
you did. Okay.
Yeah. So it was pretty authentic, right? So I literally recorded the meet and greet. I told the people, right, hey, I'm going to record it. I did not record their Q&As. So once I talked about like my piece, I stopped recording. So and they all turned their video off, so their faces didn't show in the recording. But yeah, once I didn't record them speaking or them asking questions, I stopped recording. But basically, yes, that recording was the most common questions, right? Which is, well, how soon after I enroll can I see you? Or, do you do virtual, or do it, like that? What's your general approach? What is it that you do? Right. Basically, what is it that you do for patients? That's different, so, but yeah, those automations really, really help, because you're basically giving their information up front, which is very reassuring. That's very reassuring to people, because they're like, oh, she's done this before, right? She knows what questions to answer, but it just frees up your time a lot. The other is it prevents inquiries where, and I hope I don't sound callous when I say this, people have been traumatized by the system, right? Doctors have been traumatized by the system, and patients have been traumatized by the system. And so we've had one of the other reasons we needed to do automations like this is because people would call and keep my admin on the phone for like 30 minutes to an hour, emotionally unloading about how the system has harmed them, about how, doctors have dismissed them or mocked them. And I believe it, of course I do. But when you're trying to run a business, it's hard to have my staff that I am paying hourly to listen to an unqualified lead. Hey, after you enroll, absolutely. Yeah. My first visits are an hour. My first 2 visits are like an hour and a half. And a huge part of that is to allow the patient to emotionally unload. But that's after they've enrolled.
Right.
Right. So having these automations helps reduce tying up my staff with someone that just calls to vent, and instead, again, frees them up to help patients that are already enrolled.
Right. And that brings up another point. It's, you definitely want to be answering inquiries from new people. But like you said, you have to focus on the people that are already your patients. You really want to retain them. And so you have to kind of balance both the time and the work for them. Yes. Okay. So that was great. That actually hit another one.
Oh, no, sorry, I was talking too much.
No. It's good. We're good. So yeah, that was the other thing, was the new patient inquiries, like how do you try to make that easier? So the next thing that will happen is the onboarding. And so something that people can use, and everyone really, for any systems that you have in your practice, even if you're solo, is to have your SOPs, your standard operating procedures, right? So that you're not going to forget something and remember it later, because you want everyone to have the same experience.
Right.
You don't want someone to come in and be like, well, I didn't know about that. And then they're mad and they leave. But that would be worst case. But so definitely having your SOPs for onboarding. And then what we've done, and you can still do this independently out of, any kind of system, if you just use like Gmail or some, your workspace, whatever, is having email sequences and having those emails already written out, that you can just copy paste. This is the information. This is what you need to do. And a lot of times EMRs now are really sophisticated in this, and that they do, you can do that. You can send out emails with, links to forms and, signing up. So that's something that also makes it easier, is when they have these forms ahead of time, so that they can sign those, read over agreements and things like that before they come in your office, and they don't sit in your office for 40 minutes looking at these things.
Right. Yeah. Right? Or worse, you filling it out for them.
Oh, yeah. Yeah.
Yeah. That's a nice thing about being pediatrics. Our families are young and tech savvy.
Yeah. And even my older patients, most of them actually, it's pretty good. It's pretty good. Not everyone, but a lot of them are.
Yeah.
And then, but onboarding, having an SOP, and then having like kind of like an SOP for patients, I guess, having a patient handout, like this is how we do things here. This is how you reach me during the day. This is how you reach me in the evening. This is what to expect. That was another thing. You have for your patients. Yeah. You have auto replies for things like refill requests, and then like how to schedule appointments. Yeah. You do self-scheduling. Yeah. Yeah. Yes.
And I know I was a little worried, because I was worried, oh my gosh, with self-scheduling, people are going to schedule for things like pink eye honestly, like we have our acute same day self-scheduling appointments, only 25 to 50% go utilized. So most go unutilized. People do want to come into the doctor for pink eye or ringworm. They'll send us a message and be like, hey, what do you think of this? Can you send us some antibiotics? Sure. Yes. But anyway, your SOP. So starting with onboarding. So my tech stack is, I have my CRM is a Go High Level, white label Go High Level system, similar to your Harmony Ops. And then I have Sigma MD as my onboarding. As my EMR. So but their calendar is linked, and I do have some link, but I do not have a way to link that once somebody enrolls in Sigma, that automatically gets communicated to my CRM. So we do manually have to tag, once somebody enrolls in Sigma, I do manually need to then tag that person's contact information on my CRM as a member. Okay, so I do have to manually tag them as a member. I would love a way to, I would have to do that.
I think.
Oh, really? Maybe. I would love to talk about that if that's a way. But yeah, for now, like right now, I do have to tag them as a member. But once they get tagged as member, they get an email that is a welcome email, and it's, very warm, I think it sounds very warm, like, welcome. We're so excited to partner with you. This is to help you make the best out of your membership and out of Sigma, because at that point we want them to start using Sigma to communicate with us. So basically what it explains how to use the two main things people want to do when they join a practice is they want to know how to message you and how to schedule an appointment. right? Those are the two main things. So we show them screenshots of what the Sigma app looks like to do both of these things. This is how you can send us messages. This is how you can self-schedule appointments. As now that you've enrolled, self-schedule your first appointment. And we have customized our self-scheduling appointments that the intake appointment is literally labeled first appointment intake, virtual intake. So it's like, again, you can give people a handout, they're going to forget, right? But if they go to their app, their Sigma app, and they click schedule a visit with your clinician, and they see an appointment that says first appointment intake, they're like, oh, okay, yes, that's a no-brainer, right? They don't have to remember what was in the email or whatever. That's very clear. And we have it customized. So that appointment can only be the first appointment. So once they've scheduled that appointment, it disappears as from their appointment type list. So that way you don't have some, down the road, they're not trying to schedule, an hour and a half appointment for an intake. So Sigma is actually pretty robust in its self-scheduling, and we don't have to be chasing them to self-schedule their first appointment, right? As soon as they enroll, they can self-schedule their first appointment. So the onboarding email includes how to self-schedule your first appointment, how to send us messages. And so Sigma uses this chat, that's really, it's texting, but I really like it, especially as a female doctor, because I feel like Twilio or text-based EMRs create this illusion of, oh, I'm texting my friend, whereas the Sigma app, because it is app-based, it feels more professional, I feel, and it does create this buffer of, you're not texting your friend. I am your doctor. I am your child's doctor. You're texting a team of professionals. So the way we've customized our chat boxes on Sigma is there's a general one that I wish I could delete, but I can't. That general one stays. That goes to my nurse. There's one it's labeled Josh, and that is my practice admin, and that is for prior auths, billing, onboarding, letters. Okay, so it says that, and it says 72-hour response. Then there's one that's a nurse, and that's labs, vaccines, status updates. And that goes to Becca, our nurse. And then the third one is doctor, and that is medical inquiries or after hours questions. And that goes to me. And we can all filter our inboxes so that I can see either just my messages, or I can see everybody's messages, or just me and Becca's messages. Well, we also have a refill line. Okay, a refill line that goes to Becca so she can set up refills for me. And so again, you can give people a handout or tell people at the beginning, but they're going to forget. But if they go to and when we had Atlas, people would forget, wait, who do I text for labs? Who do I text for prior auths? With their new system is they go to their app and they see, oh, wait, they have a question about labs. They open up the chat box and they're like, oh yeah, labs, this is the chat that I use. So it's a no-brainer. They don't have to remember. It's already in front of them. So our onboarding includes an explanation of all of that, how to send us messages, who to send messages to, which again, it's pretty self-explanatory, and how to schedule an appointment. And then the third thing is, here's all your intake forms, so we have a social history form, we have a mind, body, spirit form. For our PANDAS patients, we have an initial PANDAS intake where, get all the history related to PANDAS. And then we tell them how to send us medical records. They can either link their portal to our EMR, they can fax us, and that we have our fax number in there, or they can send it through the Sigma chat to Josh. So basically it's how to schedule, how to send us messages. These are the forms that you have to fill out. This is how you send us records. And then the fourth, is if your kid is sick, blah, blah, blah. If you have a question, blah, blah, like that, those kind of housekeeping issues, which again, I think it's pretty self-explanatory when they open up the Sigma app, like, oh, I can schedule, if they go to schedule a visit with your clinician, the first appointment type that pops up is an acute same next day appointment. And those are on a 1 to 48 hour rolling schedule, Monday through Friday. So that way, if someone is, my kid is sick, what do I do? And they go to their Sigma app and they click schedule your clinician, same day, next day appointment. It's very clear. And so then they can self-schedule and they don't have to remember, anything because it's already. So that has reduced. So just to give you some data on that, since we started implementing this, even though our panel has grown by 20%. Our daily messages have stayed steady like in the last 2 years because we've implemented systems that decrease the back and forth,
It just bypasses it.
It bypasses it. Right. So, cause that's one of the worries, right? Oh my gosh, the more my pound grows, the more text I will make. That's why you need systems that prevent unnecessary messages, so that as you grow, that doesn't necessarily translate to more messages. With our CRM, this is our pre-patient increase. Our inquiries, like texts and phone calls, have decreased like 80% in the last 6 months.
Wow.
But our enrollment has increased, but our meet and greets have increased by like 150%. And our actual enrollment has increased by like 30%. So less inquiries, but more. Now I would panic if it was less inquiries, but less enrollment, right?
Sure.
But less inquiries and more enrollment to me translates that to people don't have to be texting us and calling us. With our website, with our current systems, they already have an idea of what we're all about, and they're signing up for a meet and greet and getting their info that way.
Mm-hmm. Yep. They're getting their questions answered, so they don't have to call.
Yeah.
They can just go straight into the
the way
that they can enroll.
Right.
That's amazing. That's incredible.
That happened. It took 5 years, right? So that's why I think it's important for you and I to talk about it. So for the newbies, so they're like, so it doesn't take 5 years to figure this out.
Exactly. And that's what I tell people a lot is, you want to start how you want to finish. And so this is actually getting you to that point early. So that is great. And that kind of, well, when you started, how many patients did you start out with, like when you opened yours?
I had been here for 5 years. So I think the first couple of months I had like 20 pretty quickly. I think I went up to like 20, 30 pretty quickly. I know that at 6 months we were like at 50 or so. We were like at 50. And we are currently like at 120. 5 years, but we're pediatrics, and we've had a lot of churn in the last year or two, but we're talking like kids who are like in college. And I was like, dude, you're like a man with a beard now and a job. You like, it is time to go. So that we've had a lot of patients age out, So that's why it seems like we haven't grown. The other thing is we've increased our prices quite a bit. So even though, we're right now like about 120 patients, our revenue has increased dramatically because our price points have. That's the other thing, that's a whole podcast.
I was going to say, that's like a whole other
pricing, right? Yeah. So our revenue has increased dramatically, even though our growth hasn't been like, oh my gosh, it's not. Well, we're never going to be the practice that has 400 patients. I don't want 400 patients.
But, that's not with the way that your practice is. Not with the patients you have. No. So what I was trying to get to is, when you had 20 to 30 to 40 patients, that's doable. You can answer the phone. Oh, yeah. You can answer all the messages. You can take care of all of those things, especially, did you have staff when you opened?
No, I did not have staff until like 2 years later.
Yeah. So it was just you.
Yeah.
At what point did you feel like, oh, this is getting a lot. It's getting to be a lot.
Well, it's funny that you asked, because I get very anxious talking on the phone. So early on, it wasn't even an issue of I don't have time, because I had time, right? I had a lot of time. I didn't have the emotional bandwidth, right? And that's important to address also. And I don't think a lot of people talk about it, is I did not have the emotional bandwidth to be answering the phone and answering these questions and being on the phone with someone, and then to have them say, oh, you don't take insurance, or, oh my gosh, your prices are what? I just did not have it. So even when I had like my tech stack was, it was a Google Voice number and MailChimp and then Calendly. So, and email. So honestly, what I would do if somebody called, I would text them back and say, what's your email? And I will send you information through email. I really did not want to be on the phone. So, but it was still time consuming, right? Because I had to still do this manually. So somebody would call or text. I would ask them their email, then I would send them this email, right? That, this is about our practice. And yes, I used a macro for that, but these are our prices, this is our model, this is blah, blah. And then there would, some back and forth would ensue. So that was what I did early on, but it wasn't so much because I didn't have the time. It was because it was just so anxiety provoking for me.
Mm-hmm. And was that anxiety provoking because you'd never been a business owner before? Well, did you have your independent practice? Or you
No. I was always employed. I was in academics and then I was employed. I definitely think there was some shame about my price. And that's because I wasn't even that high ticket. I'm way more high ticket now, but which is where mindset coaching with Dr. Una really helped, right? Not to feel that shame about, oh, this is what I'm charging. Mm-hmm. So it was, I think part of it was shame about answering the questions about pricing and that kind of thing. And the other is, I just feel anxious talking on the phone. Like if I have to schedule an appointment, I will, and I have a, service that uses online scheduling and one where you have to call to make the appointment. I'm going to use the one where I can just schedule online. Mm-hmm. I don't know. But it was a little bit of both, but the main one was some of that shame. Mm-hmm. Mm-hmm. Which again, we don't talk about it very much, but it's important to talk about.
And I don't think a lot of people recognize that that's what it is.
Yeah. It took me a long time to recognize it.
Mm-hmm. Mm-hmm. Yeah. And I think that it's also, because people give you a hard time.
Yeah.
About it.
Yeah. Yeah.
And it's a normal reaction.
Right. It's like, do you go to the grocery store and do you go to a restaurant and be like, hey, this is,
can I just take this?
Yeah.
Because I have insurance. No.
Right.
Yeah. So for us, when we started out, I think probably around 60 or 75, somewhere in that range is when it started to feel very heavy. Yeah. It was getting overwhelming.
There's a tipping point. Yeah.
Mm-hmm. Mm-hmm. Yeah.
Yeah.
Okay. So
I would say 50. Yeah.
50. Yeah. Somewhere in that range is, and I think that's also what other people feel is kind
right.
of
Yeah.
Well, we've talked about all kinds of things.
I know.
This is really, really good. I'm so excited that you came back on and wanted to talk about this. But I want to also give you a chance to talk about two things. Mm-hmm. One, your retreat in October, and then also the DPC Women's Cafe.
Yeah, so they're both related. DPC Doc is the most rewarding thing I've ever done. I love it, but oh my God, it is isolating. And especially where I'm at as a, pediatric DPC doc, there's, I think 4 pediatric DPC docs in Indiana, and 3 of them are all in the Indianapolis area. And then there's me way over here. So it's isolating. And so I founded DPC Women's Cafe as a way for female DPC physicians to come together and commiserate and share and celebrate and connect. So we have weekly on Fridays at noon Eastern, we just meet virtually and chat. We chat about everything, anything and everything, personal, professional, questions, cases. Actually, today we're going to talk about automations if you want to join us. Yeah. So but that's what it is. And I have a newsletter that I send out again. It's organic. It's not a drip or anything. And mainly I'll have links to whenever I'm on a podcast and talk about, I'll say, hey, I was on a podcast, here's the link to it, or information on the retreat. But that's what DPC Women's Cafe is. Related to that is the retreat. The retreat this is our second year. It's in my little town of Culver, Indiana, and it has CME. We're aiming for 12 hours of CME. It's from October 15th through the 18th. It is part conference, part retreat, all about DPC curious or DPC practicing female physicians coming together and discussing things that really nobody else on the planet understands except us. So we are still looking for speakers. If anyone out there is interested, we were looking for 3 or 4 more speakers, but all meals are included. All meals are whole foods, plant-based. We're going to have yoga every morning. It includes a massage, so everybody will get a therapeutic massage. And then the content is all about physician well-being and burnout proofing practices. So my keynote, I'll deliver the keynote on gender biases in medicine and how that impacts us and ways to mitigate those gender biases in medicine. We're going to have a talk on compassion fatigue and preventing compassion fatigue. We're going to have Nurse Becca's going to give a talk about Camp Veggie and how we apply the principles of lifestyle medicine in a community-based setting. Josh is going to talk about how to onboard remote staff, because a lot of DPC docs, talk about that. And then we're going to have a talk about pricing, a Q&A on pricing, because I really feel when we talk about burnout proofing our practices, we have to talk about pricing.
Yeah. And that's definitely, as a new business owner, like you just gonna have to get comfortable with it.
It is. Yeah. And it's hard. It's hard, especially when, what's funny is though, someone else was doing the talking. Like people think, doctors in the system sometimes get a little sanctimonious about like, oh, DPC, you charge people. And it's like, well, you are too.
You just don't feel it.
You are too. It's just your staff is doing it for you. Oh, when I was in the corporate world, there were times that the front desk staff would turn away my patients because either they couldn't pay the copay, their insurance had lapsed, and I never knew about it. I didn't find out about it until later. They were doing it for you, right? They were turning patients away, but when you're in the corporate world, you can kind of turn a blind eye to what's happening at the front desk. But there's only one way to get a paycheck, and that's charging people for your services, whether it's insurance or
Right. Well, that's the thing about when you leave insurance-based employed medicine is, you are surrounded by a buffer. So you don't see all these things. And then when you go into DPC, you don't have that buffer anymore, and you have to absorb all of it personally.
So that's where I do think that's where systems come in, right? And why I like app-based or portal-based ways of communicating more than text, because the text even removes a buffer even more, because people do get comfortable and in that, I'm texting my friend Noemi. And
And then the text, even if you don't, you may not look at your phone, you may not look at the text, but it lights up, right?
It lights up.
Or it dings and it interrupts you.
Your vagus nerve goes.
Yeah, exactly. So you can't help that. And you're redirected, and then you have to come back, right? Yeah. So then you have to it takes a minute to get back into it. So there's all kinds of benefits to that. So anyway, well, thank you so much for coming.
Well, thank you. It's always fun. Always fun to talk to you.
So enjoy it, and I hope I get to make it today. The last time we talked on the Women's Cafe, we did talk about pricing.
Yeah.
So important.
Yeah. We've had some interesting discussions about pricing, and it is hard to have those pricing discussions with our male colleagues because a lot of them don't understand.
It's just different. It's different.
Love my male colleagues, but there's differences. Yeah.
Okay, so I'm going to put all of those links in the show notes so that people can find you and, look at the retreat and get signed up for the Women's Cafe.
Yeah.
All right. Well, thank you again, and hope to talk with you again soon.
All right. Sounds awesome.
Thank you so much. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you.